participants, welcome you to this webinar. My name is Dr. Vijay Mule. I am from Vetoquinol India. I take opportunity to welcome you all on Vetoquinol India virtual interaction platform. The name of this program is Veterinary Experts Speaks. This is a digital initiative designed for sharing latest technical knowledge and updates related to the veterinary field from expert point of view. I would like to thank all the registered participants who have joined this webinar through Zoom web portal. Having said that, today's topic of webinar is medicinal management of chronic kidney disease in dogs and cats and update. There is a reason behind choosing this important topic. Renal insufficiency associated with chronic kidney disease is more common nowadays and seriously affecting the pet health with an advanced age group. Many pet practitioners in India are coming across this type of cases during their clinical practice of the small animals. The incidence of the CKD is increasing day by day, and with advanced age group, research has found that 10% of the dogs and cats suffer with the CKD above 7 years of the age. Since chronic kidney disease is a slow progression in nature and cause more damage to the functional nephrons, may lead to the fetal prognosis. Hence, it is very important to know that how to manage the cases of the CKD in dogs and cats. The medicinal management of CKD helps to improve the quality of the life and life expectancy of the pets. This webinar is our effort to spread awareness about the overview on chronic kidney disease in pets and its efficient medicinal management. Now, at this virtual platform, let us understand this topic from the expert point of view. It gives me immense pleasure to introduce our today's speaker for the program, who is eminent scientist and versatile personality in the field of veterinary medicine. He is Dr. Chandrasekar, who is currently working as a professor in Madras Veterinary College, Chennai, Tamil Nadu. I would like to thank Dr. Chandrasekar for accepting our request to deliver the webinar on CKD management. We would like to take you through the short profile and some of the important credentials of Dr. Chandrasekar. Dr. Chandrasekar did his master's in veterinary medicine and PhD in veterinary clinical medicine from Madras Veterinary College, Chennai. His special area of interest is small animal internal medicine, that to a special reference to the canine nephrology, and earlier also he worked in canine oncology area. He is always open to provide expert services related to the canine nephrology, including the hemodialysis in India and abroad. Recently, he has organized one of the important event as a part of international e-symposium on current practices of canine companion animal nephrology. He has handled several research projects of the veterinary medicine. He published several research papers in national and international journals. He is recipient of several awards and in the field of veterinary medicine, like ISVM Appreciation Award, Best Presentation Awards in scientific conferences. Dr. Chandrasekar is known for his expertise and practical approach related to the successful management of clinical cases of canine kidney disease. We are really fortunate to have Dr. Chandrasekar as today's our webinar speaker. So with this introduction, I call upon Dr. Chandrasekar to deliver his presentation on CKD management in small animals and update. Over to you, Dr. Chandrasekar. Thank you.
Thank you very much, Dr. Vijay Mulaya and other office bearer of Vetoquinol. Dear participant, student, academicians all over the world. See, anybody can give time and money and giving a knowledge. There is a poet in Tamil, it's called Thiruvalluvar. what he quoted, no, if you give a education in one generation, it will give return for 10 generations. So in that context, I could thank Vetoquinol. They're providing the expertise and the practical knowledge to the practitioner and academician all over the world. They're helping one generation, means that 10 generations getting benefited. So I would like to thank Vetoquinol team by selecting me and providing this opportunity to deliver the talk on medical management of chronic disease in dogs and cats and updates. Yeah. So you all know that we'll start with anatomy, physiology, pathogenesis, diagnosis, treatment, and medical management. And all the presentations are imagine, all the presentations are image. The things why we put image, one image equal to 100 words. So in that context, I'll select my presentation in the form of images and videos. Videos I will not be able to keep because that takes a lot of time and to opening and uploading. The end user, they have problems. So coming to our subject, the renal artery, it supplies 20% of the blood from the cardiac output it receives in supplies to the various parts of the kidney, supplies to the cortex and medulla. The functional unit of the kidney, the impure blood from the kidney, it goes to the renal vein. And then so once the filtration takes place, there is a renal pelvis area, there is a space available in the middle. Through that, it travel from the pelvis going to the ureter and goes to the bladder, and then via urethra it voided the urine. The functional unit of the kidney is the nephron. There are several thousand nephrons are there in right and left kidney, and these are all the various parts. You can see the glomerulus, and you can see the proximal convoluted tubules, loop of Henle. There are thin and there are the thick loop of Henle, and then you see distal convoluted tubules and collecting blood. There are various functions. The renal corpuscles generate the glomerular filtrate composed by water, ion, and the small molecule. Proximal convoluted tubule reabsorbs sodium, chloride, potassium, water, glucose, amino acid, bicarbonate, calcium, and phosphates, secrete ammonia and creatinine. Loop of Henle reabsorb water, then reabsorb sodium and chloride. Thick ascending limb of loop of Henle reabsorb ammonium and sodium chloride. Distal convoluted loop reabsorb sodium and chloride. Collecting tract reabsorb sodium, chloride, and water, secretum, ammonium, hydrogen ion, and potassium. So coming in a simplified form in my own way, what I want to put. If some flood suddenly coming into any part of the India, so what we'll do, individual get into the flood, they will take all the essential item from their house for jewels, for money, like that. Like that kidney, once the blood coming to the glomerular corpuscle, and it filters the essential substances. Then, again, you think that some of the essential item left it in the flood. Then again, you take some of the essential items like, other items which you think essential, like that, first essential component they filters, like, water, ion, and small molecules. Then again, it will filter the potassium, glucose, and amino acids. And, like that, when the person affected in the flood, first of all, it will collect the essential item. Then again, he'll go and collect the rest of the other item. Like that, the functional unit of the kidney nephron, it reabsorbs certain constituent, and again reabsorbs some of the items, and finally excrete the waste product. This is the basis of kidney function. Then you can see the functions which I told you in the presentation itself. And the filtration taking place the Beaumont capsule. The inside, you have the glomerular apparatus, and then from the aorta, the essential component filter you can see in the form of video. There are the glittering things is going on. Then it traveling various parts of the parts of the nephron, reabsorb the essential item, the waste product getting removed. This is the basis for kidney function. Then coming to the description of the disease, it is a structural and or functional impairment of one or both the kidney that has been present for more than approximately 3 months. So in the image you can see first essential nutrient is coming to the kidney. When the kidney is affected with renal disease, there are toxic substances getting accumulated. And when we plan for the treatment, that the plan treatment period, if it is a 3-month period, that's coming under the CKD. So when the CKD means AKI, there are certain protocol, you can immediately identify the problem. If you identify the problem, correct the problem, kidney function to normal. CKD means, it's a time-consuming process. There are various staging, various steps, various methodology you have to adopt. And we started with the protein estimation. We started with the UPC ratio. We have to start with from, blood pressure measurement. We need to start from medical management. There are phosphate binders administration. There are anti-fibrotic medication administration. There are bicarbonate administration and so many other management. So apart from this, the most important thing is client counseling is very important. That's the reason we lacked when we been to Michigan State University in the year 2008. And first of all, once they receive the client, they will take it to the counseling unit. That is very important. Nowadays the pet parents should understand what is the problem with the pet, what is your plan, what is the thing you are going to contribute to the animal, pros and cons of that, what is the side effect, what are the expenses involved in the treatment. If you can tell well in advance, you will not have the problems. That is very important. So client counseling, you need to provide a separate room so that the client can understand the problem, and then it is easy for you to go ahead with the your rest of the other procedures. So you can see in the pictures, etiology, you can classify into familial, acquired, congenital classifications. Another important point which I'd like to stress is CKD is a lifestyle disaster of senior pets. The incidence increases with the age higher than 7 years. And research showed that around 10% dogs and cats suffer from CKD at this stage. And irreversible damage onset is slow progression and cause more damage to the function of nephron and thereby reduction in glomerular filtration rate, 30 to 50% reduction you can identify. It is actually a multifactorial disease and vicious circle with the fatal prognosis. Clinical symptoms appear often in stage 2. And the message from this slide, what I want to insist to the student, academician, and practitioners, majority of the time it presented to the chronic kidney disease or acute kidney disease in a delayed presentations. Do you think that it is acute kidney injury? We have seen in one study that 53 dogs we included in our study for PhD student, and in his PhD study, we thought it is acute renal failure. We did the dialysis, we did the continuous renal replacement, whatever the high-end technique they follow in US, Texas, or UC, there is the same methodology we follow, same protocol we follow, and same welfare we give it to the patient. But if it is a chronic kidney disease, means you have to manage with the certain protocols. So the message to the participant, and if you think it is a acute kidney injury, and when you look at histopathologically, they have a interstitial fibrosis or glomerular fibrosis, basement membrane defect, and so on. That finally end up with the chronic kidney disease. Why it is going like, what we have to do, what are the recommendations available globally, all those things I'll tell you one by one in the subsequent slide. And another important aspect here, you see the kidney producing on a hormone called erythropoietin hormone. This erythropoietin hormone, it stimulates the bone marrow, it produces the red blood cells. Then the red blood cell alone come in the circulations. The message is, majority of the chronic kidney disease, it will destroy the functional nephron, so erythropoietin production getting reduced. Once the erythropoietin production reduced means, then naturally less amount of RBC production from the bone marrow, and finally you will get less amount of HP, less amount of RBC in the count. So naturally it is indicating anemia. So once you identify the anemia, there are certain protocol, what you have to do, what are the drug you have to do, all those things I'll tell you in the subsequent slides. So this you have to understand, and there is anemia in chronic kidney disease. Because of anemia, the animal become cachectic and doesn't function all the vital activities. What we have to do, how best we can manage all those things, I'll tell you in the subsequent slides. And then another important aspect is, it is playing an important role for vitamin D metabolisms. For example, when the dog exposed to the sun rays, they get a sufficient quantity of vitamin D. And also when they take oily fish, egg yolk, and the fortified food, they get vitamin D3. Vitamin D, ergocalciferol. Vitamin D3 is cholecalciferol. Vitamin D2 is ergocalciferol, found in fortified food, salmon, fish, mushroom, and egg yolk. Once they get taken, it goes to the liver and convert vitamin D3 and D2 into 25-hydroxy vitamin D. This 25-hydroxy vitamin D and otherwise called calcidiol in the kidney, it converts 25-hydroxy vitamin D into 125-dihydroxy vitamin D. This is getting converted into biological active form of 125-dihydroxy vitamin D. So the message from this, you can understand in the image, the kidney playing an important role for synthesizing the biological active form of 125-dihydroxy vitamin D. So vitamin D playing an important role for various functions. One important role for bone formation. It's also playing an important role for various enzymatic reactions. So when there is a renal disease or dysfunction in the kidney, already I told you there is a less production of erythropoietin that results in anemia. Again, if there is a disease condition in the kidney, you will get only less amount of biological active form of 125-dihydroxy vitamin D. So it will interfere with all the calcium and phosphorus ratio, and then it will interfere with the bone formation or bone demineralization, all those things. So this is the way, the vitamin D metabolisms, how interlinked with the liver, how when it is exposed to the sun rays, how the food, the vitamin D that are available in the food, how they are related, depicted in the pictures. Self-explanatory. I move on to the next slide. This is also another quite interesting slide. How this when there is a low blood pressure, the renin getting secreted in the kidney, and in turn, what it does, it stimulates angiotensin converted to angiotensin 1. By the availability of angiotensin converting enzyme, it converted angiotensin 1 converted to angiotensin 2. This angiotensin 2, it causes blood pressure rises. And then, when there is a hypertension, you lose the vision and it will cause all failures. It results in renal failure, it results in hepatic failure, it results in blindness, it results in multi-organ failures. So, whenever any hypotension, less amount of blood to the kidney by a renal artery, that raw system getting activated, that you all know that liver and lung also playing an important role in this pathway, and ultimately result in increased blood pressure. So if the kidney functions with a good availability of blood, you will not have this problem. If you are getting less amount of blood, renin getting secreted, and it will result in angiotensin 1 converted to angiotensin 2. It results in a rise in blood pressure, and the rise in blood pressure, it causes hypertension, organ damages, end organ damages. There are cerebral hemorrhages, there are ocular hemorrhages, there are sudden death. All those things we can encounter. This is also important slide. One important slide which I told you, erythropoietin getting secreted in the kidney. Second important point I told you, the biological active form of kidney is helpful for synthesizing biological active form of vitamin D getting synthesized from the good healthy kidney. And the third, there is a low blood pressure, raw system getting activated, animal develop hypertension. Hypertension, you all know that it results in all organ failures. So the most important message in this slide, practitioners and academicians, whenever you see a chronic kidney disease, my humble request is check the blood pressure. Checking the blood pressure, not with the available blood pressure which are using for human being, you are not supposed to do. You have to use the veterinary Doppler blood pressure. The idea of recommending veterinary Doppler blood pressure, there are software modification in the veterinary Doppler blood pressure. It will actually accurately assess the systolic blood pressure. It can able to tell you accurately. You need to measure the three values. Mean value you have to take, and then accordingly you have to treat. What are the drug you have to do? What is the dose you have to do? If the one drug is not supporting, what is the other drug you can take? All those things I'll tell you in the subsequent slides. So these are all the histopathological changes when the animals are affected with the glomerulonephritis. You can see the uptake of the stain in the slides. And then in the case of tubular nephritis, you can see the inflammation of the tubular cells and the uptake of the staining solution also you can see in this slides. The message from this slide, whether acute or chronic, the confirmation you have to do a kidney biopsy. All your assumptions, you are dying with blood urine nitrogen, creatinine, symmetric dimethyl arginine, and NGAL, retinol binding protein, all these cystatin C, all these biomarkers, there are plus minus in that. The most confirmatory diagnosis till date in human medicine, you need to go for kidney biopsy. Kidney biopsy normally I do with the left kidney because that is superficial. You can immobilize the kidney after sedation, after getting consent from the owner. Then with the ultrasound guidance, I take the material for testing and I'll send it for histopathological examination. If the owner is affordable, I send them for the electron microscopic study. You will get a confirmative diagnosis and management will be easier. So there are several international agencies that are available. If you take biopsy and then you focus to them, they will be able to read the slide and then at the free of cost. There is a World Small Animal Veterinary Association Nephrology Society available. They are able to provide the all the technical information at free of cost to the participant. You need to Google the WASAWA guideline for histopathological interpretation. You need to refer. So then again, how the disease develops. So nephron loss, I show several thousand nephrons are there in the kidney. When there is nephron loss, you will have a hypertrophy of remaining nephron. One particular area of nephron loss means available healthy nephron, the one more, there will be hypertrophy. Then there will be hyperfiltration of the affected nephron and result in glomerulosclerosis. So once once this is happened and the problem encountered, elevation of blood urine nitrogen and creatinine. And then disease development, final step, parenchymal destruction of fibrosis in the final pathway and the end step of CKD. You can end up with the glomerulosclerosis and the tubulointerstitial fibrosis. Forget about all the histopathological descriptions, that will be boring. But you can see the healthy slide. You can see the healthy glomerulus, and you will not be able to see the much uptake of the stain. You can see on the right, for me right side, for you maybe left side. And then you can see the glomerulosclerosis. You can see the lot of uptake of the slide. And then there are atherosclerosis on the tubules. And then there are interstitial fibrosis. So this is the way you can confirm the problem to the pet parents. You can give the information to the pet parents, and they will be convinced with your activity. And in future maintenance of these type of cases will be easier. Then again, when you get into the other pathways, it's a cellular activation and injury. Fibrogenic signaling phase, fibrogenic phase end up with the renal destructive phase. These are all several phases that are encountered in renal failures. This again about at cellular level, when there is any disruption in the epithelial cell, that then you will have an increase in intraglomerular pressure. Any nephrotoxicants, it damages the epithelial cell. There will be increased intraglomerular pressure that result in hypertrophy. And it causes capillary wall stressor, podocyte detachment, loss of nephron, decreased glomerular filters, hyperfiltrations, and you will have endocytosis of protein. There are pro-inflammatory cytokines are released, the result in necrosis or apoptosis. Apoptosis is nothing but the death of the cell, and tubular apoptosis and detachment and the de-differentiations is encountered. This may be a lot of confusion to the pet practitioners. The message to the practitioner is, so any toxicants, it may be your rickettsial disease, it may be a poisoning, it may be a drugs like your gentamicin or any other amikacins. When you use excess quantity, the damages happen like this. It damages the cell, that results in increased intraglomerular pressure, hypertrophy, capillary wall pressure, podocyte detachment, loss of nephron, decreased glomerular filters, hyperfiltrations. All the inflammatory pathway sets in, there will be about necrosis and the death of the cell you will encounter. So this is the way the problem encountered. And majority of the time, why we are getting more number of CKD? Majority of the time, the animal or the dog, they try to mask the symptom. Majority of the time, the dog eats. The owner think that the dog is eating. They didn't observe they didn't worry. Actually, the dog lose the appetite slowly, gradually they lose. with the busy schedule, availability of smartphone, social media time, nobody having time to look at what is happening closely. So looking at the pet problems, a few they observe, and majority of the time, they don't find even look at the pet issues. And ask them to, if they carefully take the history, and slowly they would have reduced the food intake. Another thing, they would have told you animal is going for excessive urination because it will bark at the owner. If it is inside the house, they'll call him to go out. If it's, the dog is frequently calling, it is getting disturbed. The owner is disturbed. This symptom he will tell you, but he will not be able to tell you the animal is consuming a lot of water because that is freely available. It goes whenever it needs, it goes and take. You will not be able to observe. But some of the pet parents they closely observe, and if they are losing less amount of food, taking less amount of food, another important information, if they are consuming a lot of water and is going excessive urination, these are all the characteristic symptoms. The animal is prone to develop a renal disease, and that because the inflammatory pathway sets in the epithelial cells, there are destruction is going on. Imagine our country's lab. Recently, we observed there are. We want to analyze closely what is happening. Why worldwide our country is the only country in the world having maximum number of canine population. So the study we are doing in India, the world should listen. And the second, we are the only country in the world having maximum number of canine population. That means the study in India, the others should understand our approach, and then they give their input. Another important thing is my institution is the only institution in the world getting maximum number of canine population. The sad news in that our country is the only country in the world having maximum number of hemoprotozoal disease. 1 in 4 dogs prone to get the hemoprotozoal, whether it's a Babesia zibzoni or Babesia canis or Ehrlichia canis or Anaplasma platis. The final thing is we have a maximum number of renal disease in our state. That's because we want to have a nationwide network. I am collaborating with some of the faculty throughout the country, and I want to have a national level network in creating a national level database. Even I spoke to some of the practitioners in other country. They want to provide the database, at a free of cost. They will train the institutes so that they can share their observations. So that will become the potential asset to our institute or the nation. So the industry or the policymaker or the researchers, students, they can have a good data. When you have a good data, then the world will listen to us, and whatever the policy we are taking, and that will helpful to the patient and helpful indirectly help the human population also. I told you majority of the hemoprotozoa disease not only it's affecting the pets, the majority of the hemoprotozoa are zoonotic. Some of the colleagues from abroad, they want to work with me and they want to check how many cases of hemoprotozoa disease, and they want to collect the serological sample from the human also and check whether ECAN is present in the human being, whether the Babesia zibzoni present in the human being, and the cane is present in the human being, because it is getting transmitted to the biting ticks. Not only biting ticks, recently go through after my presentation that the mosquito can causing this problem. We all know that mosquito are there all over the world. That means any one dog carrying the problem, a mosquito bite, it is biting the infected animal, going to bite the other healthy animal, they pick up the problem. So it is there all over the place, all over our country. We have this problem. We need to have a strict quarantine measure. If my dog, I have a Dachshund, I have a Brownie ND dog, and suppose I take my Brownie and ND Brownie dog from Tamil Nadu to Mumbai, Maharashtra. The quarantine office in Tamil Nadu, they should certify, they should do a snap test. My dog is free from Ehrlichia, Babesia, Anaplasma platis, diarrhea remedy. Then only I can move on to Maharashtra. How the corona test now people are doing. Similarly, we need to adopt the snap test policy. We need to have a strict quarantine measure. Then only the transmission of the disease we can prevent. Otherwise, this problem will be there. We need to approach various protocol, various methodology, and all those things. See, these are all nutshell information about the how the etiological factors causing this problem. Another important pathways, the chronic kidney disease. You have a nephron loss, and then this already told you angiotensin II getting secreted. It results in different arteriolar constriction. There are afferent arterioles, they supply the blood to the glomerulus. Efferent arterioles, they're taking the blood and sending to the various parts of the nephron. It is when it is constricted, the less amount of the blood, and you will have a hypotension and result in intraglomerular hypertension and hyperfiltration, result in proteinuria, glomerulosclerosis, interstitial fibrosis. So another pathway, in nephron loss, it's also resulting atriolar dilatations. So other pathway in chronic kidney disease, anemia is there. I told you erythropoietin production in diminution result in anemia that causes interstitial hypoxia. And then if the intraglomerular hyperfiltration and hyperfiltration result in systemic hypertension, result in proteinuria, glomerulosclerosis, and then intraglomerular hyperfiltrations. It's these are all the connecting pathways result in aggravating the problem of renal failures. This again, this is actually electron microscopy study on the center. This is the histopathological studies. And then right side, you can see that the arrow mark, black color arrow mark, it's indicating the presence of tubular protein cast. It is indicating the excess amount of protein cast. It causes damages to the various parts of the nephron. And similarly, pinocytis of protein leading to swelling and rupture of the lysosomes. It is, the lysosome are the suicidal bags, and that itself getting ruptured, and the rupture result in, you will have a cell lining result in the basement membrane rupture, and it result in aggravating the problem of renal failures. These are all some of the electron microscope studies. And then it's also result in systemic and glomerular hypertension, intrarenal hypoxia, mineral and bone disease associated with CKD, and oxidative stress formations. The most important sign, which I already told you, the excessive intake of water, they call this polydipsia. Excessive urination, they cause polyuria. Weight loss, this is the most important clinical sign in case of chronic kidney disease. Stunted growth, this interfere with the hormonal productions. And then it's also result in inappetence, reduced quantity food intake, vomiting, because excess amount of blood, nitrogen, and creatinine result in vomiting. Apart from that, you have anemia, pale mucous membrane, and excess intolerance, and rapid breathing. All those things will be there. Rapid breathing because there is a metabolic acidosis, and the more amount of acid particle present in the blood result in to compensate that have open mouth breathing. Anemia, already told you, there is a diminished production of erythropoietin in the kidney, and that suppress the bone marrow and result in less amount of RBC productions. And this is the important clinical sign practitioners you can see. The pale mucous membrane, my opinion, there are frequently, whenever I find time, I go to US and also Canada, not that for entertainment, I'll go there, how their practice is going on, how their technical knowledge in the academic side and also the clinical side. Recently, today, before the presentation, one of my colleagues came from Texas, US, and I showed one of some important BAVP dog in the Chennai. His approach is systematic. I think student, you must adopt this. What he did when I put the dog on the table, he asked me the stethoscope, then he asked me the thermometer. Then what he did we told the history, listened the history for 5 minutes. Then I goes to the dog. Before treating the animal, he gave the treat. So the student must understand, before treating the animal, give the treat. That's very important. If you give the treat, the secret of the dog or the cat or the cattle or the horse, they are fond of food. So if you give the treat, they will come with you. They are not afraid of your injection. They will not afraid of your any other product. So the message is here is better you treat the animal with the treat. That is very important. The second message is methodological approach. So the kidney, what we do, most of my students, I say, is suspecting kidney problem. You go, immediately they will go there and collect the blood and then send it for testing. That is we have to do. But the morning, what I did that American vet, he just examined the nostril. Then you open the mouth, it examines any tartar on the teeth. Because the tartar present on the teeth, they call it as result in periodontitis. That is a potential factor result in renal failure. So none of our people, they are opening the mouth. It's the time you need to open the mouth. If you see the dental doctor, fix the appointment with them. Then you can go for, there are pastes that are commercially available that you can use them, and then remove the dental tartar. There are tubes that are available that you can buy and give it to them. Otherwise, you put your name on the toothbrush of dog. You put your clinic name and give it to them, so that the client also will remember you, and then you just gently brush it so that all the tartar will go. So then what he did, the American vet, how he examined the nostril, he examined the mouth, he examined the oral cavity, check the tongue, you look into the eye, and you check the ear, and check the lymph node, examine the scapula, humerus, and then radius and ulna, you examine the digits. Then we come to auscultate the heart, and you examine the chest, and we examine the palpate abdomen, and then move on to the back portions. You examine the hip joint, and then examine the stifle joint, and examine the metacarpal regions, tarsus, digits, examine the anal regions, and examine the female dog, examine the memory regions. So all those things. To imagine, this systematic approach is very, very important. Academician and practitioner, student, we need to adopt this approach. And this is the time, we need to take care of our pets, dental tartar, and the national, and some of the academicians, those who are attending. This is the time we need to work on our national level work, even taking care of the renal failure patients. How many of them are suffering with the dental tartar? What are the policy we have to make? How we need to rectify? That is very important. How we need to control the ticks? How we have to, well in advance, we have to diagnose. This is very, very important. Once they get into the problem, see, this particular animal is having a pale mucous membrane. Sometimes the practitioner go to the house and examine it. There is no bright light. You miss this pale mucous membrane. And sometimes when you examine the eye, suppose the animal is having a hypertension, there will be a retinal blood vessel, there is oozing of the blood, you will miss the hypema. You need to examine the eye and check whether it's having hypema, whether it's having congested mucous membrane, whether it's having a pale mucous membrane, whether it's having icteric mucous membrane, whether it's having cyanotic membranes. All those things you have to check. Then check the ears, whether it's having a pain when you palpate the base of the ear and other places. And go on to the lymph node. You need to examine the prescapular lymph node, mandibular lymph node, and examine the scapula, humerus, radius and ulna, and examine the disease whether they are having, because kidney is the organ, it's affecting all other organs. So you need to systematic examination of all other organs is very important. Now only we arranged the program on chronic kidney disease. So this chronic kidney disease also end up with cardio-renal syndrome. It can cause cardiac problem. Cardiac problem treatment it causes with renal failure. The renal failures go with the multi-organ failure. So this is the time, is a national level alert. We need to work on that very accurately. So we need to screen the problem well in advance. So we need to give the recommendation well in advance. Then only it can be saved from all the critical events. Then auscultate the heart. Auscultation, the mitral valve located on the 5 to 6 intercostal on the left side. The aortic valve, 4th intercostal space on the left side. Pulmonic valve located on the 3rd intercostal on the left side. Then you have a tricuspid valve is located on the right side at the 4th intercostal space. So how many of you auscultating all this valve, whether you are able to auscultate the murmur? The murmur, normally the sound is a lubbed sound. Instead of lubbed sound, you get a lubbous sound. That is the murmur. You will get in case of systolic murmur. Instead of lubbed, if you get lubbed that is the diastolic murmur. Nobody can teach you, but these are all skill you need to develop. It's a surgery means I can show you. See the teeth broken, leg broken. For internal medicine, you need to identify the problem. You need to understand the problems. You need to plan the problem in a peculiar manner. Then the heart is over, and when you auscultate, identify the heart rate and identify whether any pericardial emission with your auscultation. Then coming to the lung, and when animal affected with renal failure, there will be a metabolic acidosis. Animal won't eat. If they are forcibly feeding, there will be aspiration, and whether you need changes in the lung. If the animal is having a cracking, nothing but take your fur in your hand, you just rotate it. If you get some crackling sound, that is the crackles. If animals which are having pruritic friction rub, and take the papers, fold it in your hand and rotate, you will get that pruritic friction rub. That sound will be there in the animal which are having pleural effusions. So you just see the patient from a distance, how the patient is breathing. Whether the breathing you are using the thoracoabdomen or using only the thoracic part, all those things from a distance you have to examine. Then closely, keep your stethoscope on the chest, various parts of the chest you auscultate, and how the lung field, you examine auscultate dorsal field, middle field, caudal field, you examine and identify any pathology, make a note of it. Then move on to the lumbar. Lumbar is only a kidney is located. Palpation is a key important factor in case of identifying the renal problem. For example, animal is having a renal disease. Some of them, when you palpate, right kidney is cranial.
Dr. Chandrasekar, Dr. Chandra, may I interrupt you because we cannot see the screen is moving.
Oh, okay.
We can see the dogs with the gums. Correct.
Yeah, okay. I will move on. I'll move on. Vilay. Can you see this?
Correct. Now we can see. Yes, yes.
Yeah. See the next, the information what I informed you, the physical examination, finish off all the organ. Right kidney is cranial, left kidney is caudal. You palpate the animal which are having a painful kidney. When you palpate, the animal evinces pain. So when the animal is affected with renal failure, so the first slide which I showed you is the anemia. The second slide which is telling you about the excessive intake of water. And the excessive intake of water, the pet parents are the practitioners observe. This is a classical sign because renal failure, they try, it's like a local dialysis. They take more amount of water to compensate uremic conditions. And so another important thing is excess amount of blood urea nitrogen and creatinine, you will find more amount of, hyperemic conditions or ulcers on the gum and also in the tongue region. There are occasions there will be a sloughing of the tongue will be done. The message to the student, other colleagues, practitioner colleague, you just examine the oral cavity. If you see the sloughing of the tongue, there are occasions. I told you, it is playing an important role for vitamin D metabolism. And if there is a kidney disease, vitamin D, production getting interfered. And there are occasions there will be changes in the calcium and phosphorus pathways, and you will have a rubbery jaw. You can encounter it in CKD patient. This is the emaciations of patient affected with the chronic kidney disease. And then there are occasions the animal prone to develop cardio-renal syndrome. When you're treating for renal failure, they develop with the cardiac problem. When you treat for cardiac problem, result with renal failure. There are occasions you develop hyperkalemia, excess amount of potassium, anemia, I told you, hypertension, I will explain to you subsequent slide. And then there are occasional hypervolemia, there are occasional hypovolemia, you can see. Another important biomarker, if the animal is having a cardio-renal syndrome, you have a cardiac specific marker, troponin getting elevated, that's indicating for a myocardial injury. NT-proBNP indicating for myocardic stitch. So animal which are having cardiac and renal problems, and the cardiac problem, if you check the biomarker is getting elevated, we need to correlate with the elevation of blood urea nitrogen and creatinine. Both are getting elevated means there is a correlation with the cardiac problem and renal problem with the cardiac. There is a separate society also available, cardio-renal society. These are all again some of the classical clinical signs of CKD: peeing and drinking more. This already showed you. Dehydration will be there. Less active, reduced appetite, weight loss, vomiting, bad breath, ulcers in the mouth, looking pale, anemia. This everything I put it in the form of diagrammatic representation. And also see International Renal Interest Society worldwide, they have developed some guidelines and regarding the staging of chronic kidney disease based on creatinine. The stage 1 non-acidemic stage is less than 1.4 in dog, less than 1.6 in cat. In stage 2 non-acidemic to mild renal acidemia, dog 1.4 to 2, the cat 1.6 to 2.8. Stage 3 2.1 to 5, 2.9 to 5. Stage 4 in dog more than 5. In case of cat is more than 5. So these are all the some of the classifications internationally recommended. So practitioner or a student, we can make a note like this. Staging you need to classify like this. Then again, this is the same pathway which already I told you. And because the chronic disease, there is a reduced renal phosphorus cleanse, you have more amount of hyperphosphatemia. And there is a interference with the 125-diox vitamin D synthesis or the metabolism, and also result in hypocalcemia. All these risks result in secondary hyperparathyroidism. And and also it causes acid-base and electrolyte disturbances. Uremia, you will get impaired renal hormonal synthesis, and the patient with renal failure, they also prone to get urinary tract infections. Then another slide, gastrointestinal consequences of CKD. CKD patients, they develop anorexia, vomiting, the stimulation of chemoreceptor trigger zone. There will be a gastropathy, reduced renal clearance of serum gastrin. There will be a dysphagia, difficulty in swallowing, and uremic enterocolitis. This because elevated blood urea addition and creatinine. This again similar pathways, chronic kidney disease, increased phosphorus, decreased calcium, more amount of parathyroid hormone actions. What it does know, it will remove some of the calcium and phosphorus stored in the bone getting reabsorbed and result in demineralization and thinning of the bone. So these patients easily susceptible to fracture. Then how do you differentiate acute and chronic? So when you look at certain parameters, acute renal failure, renal function, sudden with getting decline, not able to perform regulatory and excretory functions. Onset of the disease in acute renal failure is sudden. In case of chronic renal failure is slow and progressive, and damages is more. Sign is a oliguria in case of ARF, CRF it is polyuria, and this hemopathic anemia may or may not be present in ARF, mostly present in chronic renal failure, and in case of ARF potentially reversible, in case of CRF potentially irreversible, specific gravity increased in ARF, decreased in CRF, damage to the functional of nephron 35 to 40%, in CRF 70 to 80%, prognosis here is favorable, and the CRF it is doubtful. You can see the danger zone in case of chronic kidney disease. This is again how the problem encountered in renal disease when there is a hyperphosphatemia, especially when the phosphorus level excess, and what will happen? It result in nephron loss, and again result in anemia, and then reduced life expectancy and reduced quality of life. This also in turn result in proteinuria and fibrosis. So controlling the phosphorus is a key component in the management of renal failure, chronic renal failures. Here again, changes at cellular level, fibrosed kidney you can see on the this is healthy kidney, this is right side kidney, how the kidney getting damaged. When there is a initial injury, activation of macrophages and lymphocytes, and you can see soluble mediator cytokine, interleukin 1, interleukin 4, and interleukin 13. Then increased this in turn increased collagen synthesis result in fibrosis. Similarly, in another pathway, cell-mediated pathway, growth factors, proliferation of fibroblasts, and increased collagen synthesis result in fibrosis. So all these inflammations result in fibrosis. Once it fibrosed, you need to tackle them with the anti-fibrotic factor. We have a solution in our Indian market. What is the solution? How we have to manage? I'll tell you in the subsequent slides. This is again alteration of biochemical parameter in CKD, how the hyperphosphatemia, how proteinuria, how azotemia, and imbalance of electrolyte balance is taking place. This already I told you in some of the previous slides. Then coming to diagnosis. Diagnosis, the classification I told you based on IRI's staging system, how the classification is going on. And then there are biomarker. Creatinine is a biomarker for kidney disease as of now. Unfortunately, the delayed biomarker. And when you examine this, by the time 70% of the functional nephron getting damaged, it is also a breakdown product of the muscles. When you use drugs like cephalosporin, amlodipine, trimethoprim, and phenoacetamide, also there will be a false elevation. When the animal take ascorbate, pyruvate, glucose, bilirubin, and keto acid, overestimation of that. Dog fed with cooked meat, elevate level of creatinine after hours. Corticosteroid use, elevated muscle metabolism, and the dehydration also you will get the elevation of creatinine. And then another important parameter, symmetric dimethyl arginine, is actually a protein available in all the cells. So it is not getting secreted or synthesized in the kidney. And what will happen, when there is a 25% of the functional nephron damages, you can detect the SDMA in the urine. But you compare with the creatinine, when the 75% of the functional nephron damage, you can detect in the kidney. And you may imagine which is more sensitive. Nowadays, SDMA they are using as the good biomarker for identifying the kidney disease, especially chronic disease. Normal value 9.8 microgram per deciliter, cats 9.6 microgram per deciliter. The animal with chronic kidney disease, both is getting elevated. So, what are the approach we have to do? All those things I tell you in the subsequent slides. This is actually, SDMA detect in kidney disease earlier than creatinine. Average of 9 months earlier up to 19 months earlier you can get it. In cat, average 17 months earlier up to 48 months earlier you can get it. And then there is a study comparing the creatinine and SDMA. Creatinine was the good biomarker they used 2007 to 2009 until date we are using. But the SDMA came into the market April 2012, and till date the importance of the SDMA being increased in the veterinary practice, small animal practice. And the creatinine also they are using, but the importance of the SDMA, but it is helpful to the practitioner or academician able to identify the functional loss of the kidney well in advance by using the SDMA. So these are all information. Then another marker is the NCOL, neutrophil gelatinous lipoclean, 12.7 nanogram per ml involved in tubular regeneration post-injury, lacks specificity in case of carcinoma, lymphoma, and it causes elevation. But useful prognostic indicator in CKD. One of my students is working on the NGAL. We'll tell you the result. Then cystatin, normal value 0.4 to 1.6 milligram per liter. Cat 0.58 to 1.59 milligram per deciliter. In case of chronic renal failure, it's both getting elevated. And the urinary exosomal non-coding RNA, urinary exosomal miRNA, it is derived from it's reflecting the changes of renal function and the histopathology. So the microRNA level, is playing an important role in detecting the renal function. Some of the study is available in the papers, and you can also, there is a scientific report, August 2016 paper. You can Google it, and then you can go through the importance of microRNA reflecting changes of renal functions. And this is the one we use identifying all the chemistry profile, metabolic profile, and then gas profile. Why it is important? These cartridges available 300 rupees. We load them here. And there is a well available in the front, we load the collected heparinized blood, and then we'll send it. Within a minute, we'll get all the changes: pH, PCO2, PaO2, carbon dioxide level. Then it will also estimate the blood urine antigen, creatinine, potassium, bicarbonate, lactate. Why it is important? You can check whether the animal is renal failure, whether the animal is hyperkalemia, whether the animal is hypokalemia. All those things we can able to identify with the help of this small ABG machine. You can buy that, it costs about 3 to 4 lakhs, but it is very important to determine whether the animal is having metabolic acidosis, respiratory acidosis, respiratory alkalosis. All those things we can identify. Accordingly, we can add and treat the animals. And this is another important machine, veterinary Doppler machines. It is used for detecting the blood pressure. Blood pressure, we check them in the pedal artery, and also in the front limb, we'll check. What we have to do is shave the fur, and there is a sensor is available. After applying the gel, we apply the sensor. Then there is a cuff available. We connected with the front limb. Then this is the manometer. We just increase the pressure, and once you increase the pressure and make them to cease the sound, there is a hissing sound that the machine will produce. And once you slowly release one particular sign, again you will get the hissing sound. That hissing sound is the correct systolic blood pressure estimation of the dog. I told you less than 140. Blood pressure is normal. More than 140, it needs our attention. What you have to do, all those things I'll tell you in the subsequent slide. Then ultrasonography is a potential tool to identify the acute renal failure, the chronic renal failure. Normal kidney, you have a cortex, and medulla differentiation clearly. But in case of chronic renal failure, this differentiation won't be there. The borders are irregular. You can see in the subsequent slide. And you can see the renal cyst. It's a congenital problem. And this we have to treat the owner rather than treating the animal, because the cysts will grow bigger and bigger. And it's very difficult to treat because it's a hereditary disease. And you can see the increased corticomedullary junction hyperechogenicity. Those who are having ultrasound, you can see the echogenicity of the cortex, and then the kidney also glowing. And when you compare the echogenicity with the liver should have this echogenicity. But here you can see, compared to liver, this is more bright. That means kidney functional neuron getting damaged. And then there is a kidney volume we measure, length, width, and the diameter of 0.53. It will tell about the kidney volume. But it is not that much important in the criteria. We also did this statistics, and normally what is the length? Where in case of chronic renal failure, acute renal, there is a difference. When you measure the length and the width, left kidney iota ratio 5.3 to 9.1, less than 5.3 chronic kidney disease, more than 9.3 acute kidney injury. So you see in the image, you can irregular cortical surface. It's not uniform. It's not straight. So these are all characteristics. Then cortex medulla differentiation is also not there. This is another important thing. And here again you can see the changes in the corticomedullary junction. Indistinction is there. Then this is the medullary rim sign, and the animal exposed to the toxin, especially leptospira, you will get a medullary rim sign. Toxin exposed case, you will have medullary rim sign. A similar observation in this picture. And the Doppler studies, what he is telling, no, when you have a more amount of good kidney function, you will have a good flow of blood. Animal which are having diminished kidney or chronic kidney disease, you will not get this much of flow of blood. These are all statistical methods useful for academic purpose. It may not be useful to the practitioners. And also, kidney with the advanced stage of chronic renal disease presenting hypovascularization, you will not be able to intrarenal vessels hardly visualize with color Doppler because of this. Also, how we are estimating the systolic and diastolic pressure, how the RI we are estimating, how we are estimating the mean value, how we are calculating. These are all assessing the blood flow velocity in the renal artery to determine the kidney disease. These are all research-based data, but the message is RIPA will be more in case of a patient affected with chronic kidney disease. Here again, the classification again, urine protein creatinine ratio. If with the UPC ratio, you have to do it in urine. If the urine protein ratio more than 0.5, it is proteinuria, it needs your attention. What is the attention? I will tell you in the subsequent slide. The microalbuminuria, the upper limit 30 milligram per deciliter. So more microalbuminuria in the microalbumin in the urine, then it needs our attention. And then this already I told you, BP less than 150 normal, and then BP more than 150 needs our attention. What is your interpretation? All those things I tell you. Then specific gravity, we told you, AKI specific gravity more, in CKD specific gravity will less. So it's ranging from 1.06006 to 1.020. In advanced case, is 1.008 to 1.012. This is already we told you. And then client counseling. And before the presentations, this is the only company so far I have been taking lot of classes all over the world throughout the country. This is the only company asked me to put a PowerPoint slide for the pet parents. Because the client counseling is very important. The company understood, what to be communicated, where we are lacking. So the client communication is very, very important, and they requested me to put the slide. So when you take all the parameters, you just communicate to the parents, pros and cons of that, explain to them, because it is not a one-day job. If a surgery, if it's cystotomy, I can do one-day job is over. And if it is a GDV, just I'm correcting, one day is over, the next is followed. But CKD, it is a years together management. You need to have that bond and relationship with the parents and all the pets, then only the people will understand. And then current protocol in the management of CKD. So lack of time, I'm resting up. Hydration therapy is very, very important. The important fluid of choice in case of chronic disease, we prefer Ringer's lactate. And then sometimes we use diuretics if there is an excess amount of fluid to remove the waste products. Management of nausea and vomiting, normally we use ranitide, metoclopramide, vandelcitron. Controlling serum phosphate and calcium level, we use the phosphate blender. What is the phosphate blender effectively helping? And all those things we'll tell you. And also vitamin D therapy. Minimizing proteinuria, we give renal diet. And management this hematopoietic anemia, we give you not only erythropoietin, we have a darbopoietin to give. Systemic infection, antibiotic therapy, dietary intervention, there are the various renal diets that are available. Improve the life expectancy of the patient, supplement the antifibrotic drugs, rhubarb extract to reduce the further infection of functional nephron, and the phosphate binder, chitosan, excrete uremic toxins. Or these two drugs, how much it is helping in the Indian practice. When they enter the Indian market, we saved many number of patients. The longevity has been increased, and we found a better comfort in the animal. The pet parents attachment also we found. And many times, when drug is not available in the market, we are not worried. When these drugs not available, the Nipaket Rubin are not available in the market for some time now, the pet parent pressurized us, where is the drug, when it will come, all those things. They search Google, they search the Amazon, they face a lot of problem. When they invited me also I told them when it will come to the Indian market. They told already it's come to the Indian market and you can make use of it. Not only that, there are other products. My colleague from US came to India recently. It is here, and he told a lot of Vetoquinol product and their importance in the practice. And then we have limited access throughout India. Few centers we have hemodialysis and dialysis for pets. So it's CKD, the medical management. Even I do CRRT, I do intermittent hemodialysis. But the problem, if I do during the time, it will reduce. But after that, it will go up. So what is the further management? How best we can prevent the fibrotic condition? How best we can reduce the phosphate excess? That's a key role in doing things. And then this again, removal of root cause, management of weed, this everything I told. I move on next slide. The fluid therapy already I told you, started. This also I moved. Then proteinuria, if the proteinuria is more than 0.5, what we do, no, we put them with enalapril, 0.5 milligram per kg body weight. And there are occasions we also use benazepril, 0.2 to 0.5 mg per kg body weight. And we see the case and how it is responding. The proteinuria getting reduced, the animal feel comfort. That's the way we'll manage the proteinuria conditions. And there are dietary sodium reduction they recommended. And then the cases which are not responding, no, we need to look into the various protocol. And when you are putting angiotensin converting enzyme inhibitor, see that animal should have a proper hydration. If the animal is having dehydration, you have to care, care not to introduce angiotensin converting inhibitor or calcium channel blocker. We are with or without angiotensin receptor blocker treatment to unstable dehydrated dog as a glomerular filtration rate may drop profusely if these drugs are introduced before the patient is adequately hydrated. So that's very important. And the Darbo, see the anemia patient, I told we use darbopitin and 0.8 microgram per kg body weight. We can use supplement. It is available in Indian market. Outside it's very costly. You move with some wholesale vendor, it's somewhat reduced. This is the way we do management. Dialysis. One of the technique. We have a dialysis center. We do dialysis. We collect the blood. We take the blood from the jugular vein, send it to the artificial kidney, purify the blood, and send it to the patient. The slide seems to be nice. It's like a lot of laborious process, a lot of cost involved. And this is an high-end machine. So US, most of the UC Davis Center they have. We also do all the procedure in this. And there is an artificial kidney. This is a high-end machine. It's like everything automatic. Just we put the jugular catheter and send the blood to the artificial kidney, purify the blood, and the purified blood sent back to the blood. That's an essential dialyzer solution we hang below. The dialyzer solution go up, blood come down. So through osmosis, convection, and absorption process, the toxin getting reduced, then purified blood sent back to the patients. And the peritoneal dialysis, this is a way we introduce the catheter 2 to 3 centimeter lateral to the midline, we put the needle, then introduce the catheter, we administer dialysis solution, 10 ml every flow body weight, and we infuse every 1 hour, we leave it with the patient. After this, we drain. The peritoneal dialysis itself one class, ISD itself one class, CRRT itself one class, we'll do it in subsequent time. The treatment of phosphorus concentrations. So based on treatment also, target serum phosphorus concentration is 2.5 to 4.5 stage 1, 2.5 to 4.5 stage 2, 2.5 to 5 stage 3, and 2.5 to 6 is then another criteria they normally follow. Management of hyperphosphatemia, I'll go back. So Epaquetin is the phosphate binders. And there is a lot of evidence suggests that chronic reduction of phosphate intake to maintain the plasma phosphate concentration of 1.5 millimole per liters is beneficial to patients with CKD. More realistic post-treatment target for dog at stage 4, and it's very important. The following measures can be introduced sequentially in attempt to achieve this. That dietary phosphorus restriction is very important. There are clinically related diets that are available. If a plasma concentration remains above 1.5 or 6 milligram per liter, after dietary restriction, give an enteric phosphate binder such as aluminum hydroxide, aluminum carbonate, calcium acetate, lanthanum carbonate to effect starting at 30 to 60 milligram per kg per day, divided dose to mixed with each meal, mixed with food. The dose required will vary according to the amount of phosphate being fed and the stage of the kidney disease. Treatment with the phosphate binder should be effective with the sign of toxicity limiting the upper dose rate possible in given patients. Monitor the serum calcium and phosphorus concentration every 4 to 6 weeks until stable, and then every 12 weeks. Aluminum toxicity has been reported in small number of dogs with the stage of 4 CKD. Clinical signs include muscle weakness, encephalopathy, microcytosis. If aluminum toxicity is suspected, serum aluminum level can be measured, and if required, alternative phosphate binders are recommended. Hypercalcemia should be avoided. Combination of aluminum and the calcium containing phosphate binder may be necessary in some cases. Evidence suggests that judicious use of calcitrol prolongs survival in dogs of stage 4. So where phosphate controlled and the ionized calcium and the PT3 are monitored. All those things you need to monitor. And these are all some of the slides And ipacatine is the phosphate binder. Rubinol, we told there are fibrosis in the chronic kidney disease. That's the reason it takes longer time to recover. But by using this antifibrotic product in the name of Rubinol, you will have a better recovery and with their antifibrotic actions. And it is actually the Rubinol is having a rhubarb extracts, antifibrotic in CKD, prevent nephron loss in CKD caused due to various factors. It's Ruhin antagonists the effect of TGF-B1 and beta-1, and the Ruhin inhibitor TGF-B1 induces plasminogen activator inhibitor 1. And this PA1 involves increased thrombosis and fibrosis. Imodine inhibit the growth of renal mesenchymal and tubular cell. Imodine also decrease the extracellular matrix production. So the antifibrotic action initiated, you will have a better comfort and better recovery. There is a video, how it functions, how it take care of the fibrotic conditions. Then Rubinol, this is can be given in CKD and renal failure. Should be started from stage 2 as per IRI's guideline, or when serum creatinine level goes beyond 1.4 milligram per deciliter in dog and 1.6 milligram deciliter in cats. Ingredients: rhubarb powders, 2 kg half a tablet twice daily, 8 to 12 kg half a tablet twice day, 13 to 25 kg 1 tablet twice a day, 26 to 45 kg 2 tablets twice a day, more than 40 kg 3 tablets twice a day. You need to follow. There are 60 tablets available in the packet. Ipacatines, minimize the CKD losses due to hyperphosphatemia or excess uremic toxin. Calcium carbonate bind with the dietary phosphorus to make insoluble salt and thus make it unavailable to the body. Chitosan has got absorbent property and reported to remove a lot of uremic toxins directly from the intestine. Ipacatine also avoid abnormal increase of calcium carbonate in the blood. We told you in the pathways, when there is an experiment of phosphorus, how it will end up with hyperphosphatemia. And in turn, this also causes hypocalcemia. But when you do this ipacatine, it will bind with the phosphorus that are present in the system, and thereby, you can initiate the regularization of the calcium. Thereby, hyperphosphatemia also can be prevented. Demineralization can be prevented. Thinning of the bone can be prevented. Rubber jobber can be prevented. There are some multivarious advantages by using ipacatine. And then there is an emergency focus examination. It's an invaluable tool for the assessment of management of emergency patient. Emergency patient, this article also available in the internet, and you go through that by using ultrasound. How that kidney you can assess, how you can identify the bladder problem, how you can identify the ureter when they're having ureteral obstructions, when they're having a urinary nephron kidney stone, how you can identify all those things. You can visualize by having the thorough ultrasonography. And then expenditure of PET in CKD management prevent damage to the functional nephron and prevent renal damage to the hyperphosphatemia. It reduces fibrosis, blocking TGF-B1 and inhibit the growth of renal mesenchymal and tubular cells. This already I told you. Then in case of by using ipacatine, bind the phosphorus intestine and prevent reabsorption in the bloodstream. And so this is already I told you ipacatine shall be given in CKD and renal failure. Ingredient, the calcium carbonate, chitosan, lactase. I told you how this playing an important role for controlling the phosphorus. And then packing available 180 milligram. So 2 gram, 10 kg body weight you ought to give. So this is the nutshell information about CKD and its management, globally. And so this is the time academic institute, industry, and practitioner, they should join together. We need to work on how best we can take care of the kidney patients. In UC Davis, there is a separate diplomate program, small animal nephrology and urology. There is a diplomate program, 3-year studies, like internal medicine, like emergency critical care, dermatology, like that. Nephrology, urology, they created. So now you can understand the importance. They have a separate society. In US, they have a veterinary nephrology urology society. I also collaborate with them. There is a center in Japan called Japanese Veterinary Nephrology Urology. Europe, there is a separate center, European Veterinary Nephrology Urology. Keeping that in mind, we initiated the Indian Veterinary Nephrology Urology Society. So industrial partner like Vetoquinol and other team members. And they are with us to taking care of the renal patients. There are a lot of research involved in bringing the Ipocatine and Vetoquinol. We are able to see the finished product. And there are, a lot of ongoing research is going on. This is helping very well to the renal failure patients. With this, I'll conclude my talk. And any of the questions from the participant side, I think Dr. Vijay Mullai or Sachin can collect and then they can ask me. So I can also see in the text box if it is available. I will get into the chat box. I'll see any question is available.
Yes, sir.
I'll go ahead.
Thank
a lot of questions available.
Thank you so much for your informative presentation, Dr. Chandrasekar, and elaborative discussion on this important topic. Since this topic, CKD management is, that one of the important priority in the canine practice, and the cases of renal diseases are increasing day by day. It is very important to understand this topic, and you have made this topic simpler, sir. And thank you so much for your the detailed information on this topic. I'll request Sachin to take a few questions questions on this particular topic, because we cannot take
Dr. Vijay.
Yes, sir.
Vijay, sorry to interrupt. I will go ahead. I'm able to see in the chat box.
Sir. Yes,
And I will go ahead. If I get any problem, I will get it to you.
Okay.
Yes, sir.
Okay.
Could you please stop the presentation, sir? So
they can visualize. 1 second.
Yeah, yes, sir.
Okay. And then I'll get into the chat box.
Yes, sir.
I will start from bottom.
Yes, sir.
Oh, too many questions. India is awake. Okay. See, Yash Doshi is asked. So, what about enteric dialysis using renodial? Do you recommend to use them? That's yes. There are studies, stating that this renodial is a prebiotic and probiotic, and they have a beneficial factors. They do a local enteric dialysis. You can use them as per the recommendations, and we also carried out a small research. We found a lot of good observations. We are going to shortly publish our observations. Yeah, Yash, you can make use of that. And then Arsha GV, could you suggest some homemade food that provided the CKD dog? At the when I provide the PowerPoint, I share it with Vetoquinol. We'll also give you the homemade preparations that you can prepare and give it to the pets. But my suggestion, there are a lot of research involved in the company side, and if you can use that, that will be better. But if you have a problem, you can very well make use of the component. And CKD, right? And they are tell about renal diet. See, there are empty number of renal diet that are commercially available with less amount of phosphate restriction. And that also in my presentation I told the renal diet you can use, that you can use. And so the Mukesh Kumar asked, what is the function of renodial capsule of CKD? See, what the renodial does now, when you animal suffering with the renal failure, there is a dysbiosis. That means the beneficial bacteria in the gut getting interrupted, and there will be a more amount of harmful bacteria. This more amount of harmful bacteria will aggravate the problem of renal failure. I'll put it in a nutshell. There's a prebiotic and probiotic that are commercially available in the market, and that can eliminate the bad bacteria. There will be a beneficial bacteria available in that capsule. So when there is a more amount of beneficial bacteria, it will destroy the harmful bacteria. So the creatinine value, getting reduced, and the longevity also it's improved. That was the component. Even recently, I saw in the Beyond TV, World is One. There is a TV. There is a British Medical Journal. In that they mentioned, there are beneficial bacteria. It determine your mental health, the individual performance, availability. There are several thousand million bacteria available. So the beneficial bacteria, it will help you in reducing the renal biomarkers, and that will give the comfort. And then the Asha GVC asked, so what is the homemade diet? See, you can use cooked wheat rice, substitute the rice baby cereal, and you can add either above with meat broth during cooking. But the cooked wheat rice you can use 237 gram, and regular cooked beef you can use 78 gram. Large boiled egg you can use 20 gram. White bread you can use 50 gram. Vegetable oil 3 gram. Calcium carbonate 1.5 gram. That calcium carbonate already Vetoquinol they are providing in the product. Ionized salt 0.5 gram, and totally 390 gram if you add. That means your homemade preparation is ready. So this will also, we'll send it to you to the Vetoquinol. You can have it. And
sir, there are some questions in Q&A segment also. There you can.
I'll go ahead one by one. And
yes, sir.
Any water intake guidelines? There is a Dr. Koshav. He's asked water guidelines. See, if you take, the animal is taking more amount of water. Actually, it's beneficial only, but you cannot restrict it because that will reduce the clearance of the toxin substances. And how to prevent acute kidney injury progressing to chronic kidney injury? And then there is an anonymous attendee, and ask you have to refer the case so that it will prevent the chronic kidney disease. And this is the only person, Chaudhary. Thanks for sharing your knowledge. Can you share a complete PDF of this project? Yes, definitely we'll share. Otherwise, Dr. Vijay Mullaya, Sachin, they won't leave me. And then a papaya leaf extract, another person used in kidney failure patients. The thrombocytopenia, if the patient is having this papaya extract, they found some beneficial factors that will improve the platelet count. For that, they are advising papaya extract if the animal is having a thrombocytopenia. Yeah, the fluid therapy normally, they develop metabolic acidosis. The best fluid therapy, we use ringus lactate. Oh, so these are some side Prashad he asked about flush the kidney first and whether it is feasible or not. Flushing the kidney is not possible. Maybe you can infuse the fluid via intravenous route with ringus lactate. That will give a lot of comfort to the patients. There is a scientist, Dr. Vibor. Why don't you practice kidney transfer rather than dialysis and immunodepressant? That can be boon to canine lover. Yes. As of now, the available research globally, we take the canine transplant and the feline kidney transplant in US studies. They have a 50% failure till this second. And we have gone through some of the literatures. We want to work with some of the human transplant center here. We are planning in futures to start a transplant with some methodology. And we want to work with some stem cell also, because the stem cell also helping in some of the chronic kidney disease condition. We need to just infuse via blood vessels. Sometimes we can infuse via ultrasound guidance. If we infuse stem cell, we found a better response in cat. And but cat, dog, there are a lot of rejections, lot of failure rather than success. So that is the problem, Dr. Vibor, and we are working on that. And then so Dr. Praveen Kulkarni is asked whether you can use astamin 3 in CKD. See, protein with high biological value you can use. The astamin, these are all amino acids. And already the animal is having proteinuria, supplementing this, it will aggravate the problems. And instead of that, better you go for the commercially available pet food. So someone is asked antibiotics. Ankit Narag, he asked antibiotics safe in CKD. If the problem is due to leptospira, you go for amoxicillin and cloxacillin for 3 days. Then doxycycline 10 mg per kg body weight. If the problem is due to any hemoprotozoal disease or leptospira, you can go ahead. But other antibiotic, you need to think it over. Especially aminoglyc is an antibiotic you have to avoid. How to manage? Some Ajay Keshavarni is asked how to manage only SDMA is elevated with the other parameter being normal. The thing is, SDMA is a yearly biomarker. It is telling you that the animal is having a kidney disease. You need to counsel the owner, and probably the dog or the cat going for renal failure. That's the way we need to. Whether other parameters going up, then you need to aggressively address the problem. At this time, probably you go for phosphorus restricted diet, phosphate binders, and then antifibrotic agents, renal diet, all those things better to address. See, the Praveen Kulkarni asked, CKD, can I use soda bile? Yes, you can use. Only thing is, you want to check the bicarbonate level in the blood by using blood gas analysis. If the value is less than 18 microgram, the milli equivalent per liter, then you can go for sodium bicarbonate. There are 7.5% of sodium bicarbonate available in the market, and that you can make use of it. 1 ml every kilo body weight you can administer to that. Another important thing is Anuj Arora. She has been using 10-month-old weight 25 kg ARF due to carfulfan and Visolone within 3 days. He's asking whether the dog can develop kidney infection in 3 days. And suppose the younger dog is already having renal failure by using the main culprit by renal failures, all our anti-inflammatory drugs, especially your meloxicam and carfulfan and other anti-cancerous drugs like doxorubicin, cyclophosphamide, vincristine, all your antifungal drugs mainly. Antifungal drug, your fluconazole, itraconazole, ketoconazole, all these things are nephrotoxicants. So cautiously we have to use, and probably animal immunocompromised while using this carfulfan and Visolone, and probably it would have get into the problems. But 3 days developing a renal failure by using this dose rate, I think normally they won't develop this dose rate within 3 days. If you are giving for a month and years together, they put it out, because I used them for 5 to 6 years. Their dog, they lived happily. They didn't show any problem. And that is the message. Then Amit Raj is asking about dribbling of urinary incontinence. We have to check whether the sphincter problems or the bladder contractile problems. So probably you can try with the phenylpropylamine, and that can help. And check whether the which neutered, which also they prone to develop incontinence. That you need to check. Those cases you will have to administer estrogen containing drugs. And there is a person is asked, which are the biomarker which can use. See, your creatinine is the delayed marker, and better use SDMA or go for NGAL, or you can use for retinal binding protein for acute renal failure. Or there are kidney injury molecule for acute renal failure. CKD, use SDMA. That is the best marker which I can suggest. Stages, we told you, first stage, second stage, based on creatinine, based on UPC ratio based on blood pressures, everything we told. That was the questions. There's a question, so Dalmatian having 10-year-old having creatinine more than 30 milligrams. So Dalmatian prone to have urate crystals. There is a defect in the uric acid metabolic pathways. And what we need to do is, we need to check any crystals or the stones that are present. And if it is not there, better 13 creatinine, age 10 years, probably CKD, one sitting of dialysis. Then after that, management to the phosphate binders, renal diet, ringus lactate, antiemetics, anti-ulcerous drugs. This is the way we need to manage. And these are the essential questions which I gone through, Dr. Mulya and Sachin, from bottom to top.
Thank you, sir. Thank you so much.
Thank you so much, sir, for the detailed information and answering the queries which are there in the from the participants. I also thanks all the participants for your patience listening and really appreciate your, sir, from last 1.5 hours you are delivering the lecture continuously on this particular topic. And it's really interesting information, and it's a very useful information which will add value to all the pet practitioners as well as academicians and the students who have joined this webinar. So I request now Mr. Anjan Kumar Das to present the vote of thanks.
Okay, good evening all. Thank you, Doctor. And on behalf of Vetoquinol, it is my privilege to propose a vote of thanks on this occasion. I would like to express my gratitude to all esteemed delegates of the webinar for their presence and contribution to make the webinar a great success. Actually, without their presence, this webinar might not be a great success. I extend my gratitude to our honorable speaker of the day, Dr. M. Chandrasekar, who was not only sparing his invaluable time with us, but also he has enlightened us with the rich knowledge on the subject, specifically on the medicinal management of chronic kidney disease in dogs and cats. And the elaborated information was so much so that most of the chat box we have seen, they want their information and the PDF form or in the present PPT form. So it clearly indicates that how much the information is required on this subject. Yes, sir. You have make this evening in this webinar. Really, it was a very good presentations and detailed presentation. And thank you, Doctor. And I also thanks to our MD, Mr. Gautam Chatterjee, who has inspired us in working towards the goal of conducting the series of webinar as a part of our Veterinary Expert Speaks program. As a Vetoquinol, we have taken Veterinary Expert Speaks program as one of the important topics to provide to create awareness on different subjects and to enrich the knowledge to the customers, to the doctors, to the society. As Mr. Chandrasekar, Dr. Chandrasekar has clearly told, the information as an industry and academician, we have to work together to create the awareness among all of our customers to make the society better. And I also thanks to all of our team members of my marketing team and the sales team for their sincere efforts for organizing this webinar. Without their efforts, this webinar might not have been conducted so meticulously. And once again, thanks to all the participants, all the people, those who are present in this webinar. Thank you, one and all.
Thank you.